What we want to do now is look at the clinical features of hypoxia, because this only means anything if you can relate it to your patient care. And of course the first thing you need to do is detect whether your patients are hypoxic or not. But to understand this first, we need to look at some physiology. We need to look at how the body detects the levels of oxygen in the blood and what it does about it. And this story begins with specialised structures called chemoreceptors. Chemoreceptors will detect the amount of oxygen in the blood. Let's look at where these are detected in the body. So here we have a major blood vessel. Here we have the aorta. Of course, coming from the carrying oxygenated blood from the left ventricle. And actually, in the walls of the aorta itself, there are some of these chemoreceptors. Receptors that will detect the level of oxygen in the blood passing through the aorta. And up here, of course, we've got the brainstem, particularly the medulla oblongata. So the medulla oblongata of the brainstem is up there in the brain, and here we have the chemoreceptors in the arch of the aorta. And there are nerves that go from these chemoreceptors up to the medulla oblongata of the brainstem. And these carry information about the amount of oxygen in the arterial blood. So the blood's leaving the left ventricle in oxygenated form. The levels of oxygen are detected in this arterial blood, and nerves, sensory nerves, are taking this information from the arch of the aorta up to the brainstem. And of course, more or less directly, and I won't do the detailed anatomy, but here we've got the large arteries going to the brain, which derive from the aorta, the carotid arteries. And you might remember that the carotid arteries, there's an external one and there's an internal one. And the internal one is carrying blood directly to the brain. So this is the common carotid artery here, the external carotid artery and the internal carotid artery. And just here, there is a carotid body. And this carotid body is receiving blood actually from the external carotid artery, and it's detecting the level of oxygen in the carotid artery. And in this first part of the carotid artery here, the carotid sinus, again, the amount of oxygen in the blood is being detected. And other nerve fibres from the carotid sinus and from the carotid body are carrying information again to the medulla oblongata of the brainstem. So the level of oxygen in the blood is being detected in the aorta and in the carotid arteries. And of course it makes sense that the level of oxygen in the blood is detected in these places, because this is on the way to the brain, the most sensitive tissue to hypoxia, and this is directly on the way to the brain. And in fact, these chemoreceptors here are more sensitive than these ones here. So the volumes of oxygen, the amount of oxygen in the blood going through the carotid arteries on its way to the brain is constantly being monitored. Detected by the brainstem. And of course the situation is the same on the other side. The other carotid artery is also taking information to the medulla oblongata. Now, if the amount of oxygen in this blood is reduced, this is detected within a second, a fraction of a second even, by the medulla oblongata of the brainstem. And of course this contains the respiratory centre, it contains the cardiac centre, and it contains the vasomotor centre. So these centres are essentially informed if the levels of oxygen in the blood drops. And what will happen if the levels of oxygen in the blood drops is the brainstem will initiate increased sympathetic outflow. There will be activation of the sympathetic nervous system. And when you sympathetically stimulate the respiratory centre, you're going to get an increased rate and depth of respiration. Breathe harder, breathe faster, breathe deeper. So one response to hypoxia will be the patient trying to breathe faster, trying to get more air in. The cardiovascular centre will also respond. Now what happens when you stimulate the heart in a sympathetic way? It beats faster, it beats stronger. The heart rate will increase, cardiac output will increase. There's also a sympathetic outflow from the vasomotor centre. What effect does a sympathetic outflow increase from the vasomotor centre have? Well, it causes a peripheral vasoconstriction. There's a peripherally vasoconstrictive effect. So when the level of oxygen in the blood here and here drops, that's detected by chemoreceptors. The information is sent to the medulla oblongata of the brainstem. This responds by increasing respiratory rate, increasing heart rate, and attempting to bring about a peripheral vasoconstriction. So here we have a model of the heart, and actually we could just go back a minute. Here we have the coronary arteries. This is the left coronary artery here, the left anterior descending branch. This one going round to the back is called the circumflex branch. And if I just rotate the heart here, we can actually see the right coronary artery coming down here. And of course, if the lumen of the coronary artery is occluded, then the area of the myocardium that this coronary artery normally supplies with blood will be ischemic, and because it's ischemic, it will also be hypoxic. Here we have the arch of the aorta, where the chemoreceptors we've just considered are located. And if we take the wall of the heart away here, we can see quite nicely the cardiac septum, the thick myocardium of the left ventricle on this side. And if I tilt this round, we can see that the left ventricle here is pumping blood through the aortic valve there, that we can see the cusps of, into the aorta, oxygenated blood being pumped from the left ventricle through the aortic valve into the aorta, going up to the brain, and of course this is carrying blood around all of the systemic circulation. The inferior vena cava is taking deoxygenated blood back up to the right atrium. Here we see the superior vena cava bringing blood back down also to the right atrium, and this blood is going to be pumped through the right side of the heart and go in this vessel here, the pulmonary artery, to the lungs. And of course it's blue because it's carrying deoxygenated blood. Conversely, the left ventricle is going to pump the oxygenated blood that has come back from the lungs via the left atrium out through the aorta. And this model doesn't show it particularly well, but the aorta actually goes back and arches down through the thorax and on into the abdominal cavity. Now the arteries are a little bit complicated here, but I think we can see here that we've got the left and the right carotid artery carrying blood up the neck. And of course, if you want to assess a central pulse, feeling the carotid artery at round about the level of the thyroid cartilage, the Adam's apple, is probably the best way to do it, because you're feeling all of the common carotid artery taking blood up to the brain. And if we just turn this round slightly, we can see that this artery is going on up, external carotid artery taking blood round the side of the head, internal carotid artery shortly will go through a hole in the base of the skull, taking blood directly into the brain. This will be the area of the carotid sinus, and the carotid body is just between the external carotid artery and the internal carotid artery in this area just in here. The chemoreceptors in the carotid body and internal carotid artery are exquisitely sensitive to the levels of oxygen in the blood, and they're going to carry that information up to the medulla oblongata of the brainstem. And if we actually take this brain out here, we can see this is the brainstem here, midbrain, pons and medulla oblongata. So the information from the aortic arch and from the carotid body and carotid sinus is being taken to this area of the brain here. And it's this area of the brain that is generating the increased sympathetic outflow that is the body's attempted compensation for blood hypoxemia. Well, here we've got my diagram of the physiology we've just discussed. Oxygenated blood is coming from the left ventricle into the arch of the aorta, and there are chemoreceptors in the arch of the aorta detecting the level of oxygen in this blood as it passes through the aorta on its way to the general systemic circulation. And this information is being taken up sensory nerve pathways to the brainstem. And as we can see on this diagram, these are branches of the vagus nerve. Also, the blood is passing up the common carotid artery, external carotid artery, internal carotid artery, and we know that the carotid sinus is here. Sorry, the carotid body is there. The carotid sinus is actually the first part of the carotid artery. And the oxygen is being detected by the carotid body and the carotid sinus. This information is being taken up to the medulla oblongata of the brainstem again, and this time we can see it's in a sensory branch of the glossopharyngeal nerve. So information about the level of oxygen in the blood constantly being processed by the medulla oblongata. If the level of oxygen in the blood drops, there is increased sympathetic outflow from the medulla of the brainstem. Outflow from the vasomotor centre is going to cause vasoconstriction. Sympathetic output from the cardiac centre is going to increase heart rate and volume, thereby increasing cardiac output. And sympathetic outflow from the respiratory centre is going to increase the rate and depth of lung ventilations. Now, the chemoreceptors in the aortic arch and in the carotid bodies are described as peripheral chemoreceptors. And as we've seen, these communicate with the medulla oblongata in the brainstem via the glossopharyngeal nerve and the vagus nerve. So the nerves from the carotid body and carotid sinus are the glossopharyngeal nerves, sensory branches of the glossopharyngeal nerve, and the sensory nerve component from the arch of the aorta to the medulla oblongata are branches of the vagus nerve. And when hypoxia is detected, this induces increased sympathetic outflow from the brainstem. Sympathetic, remember, is the fight or flight component of the autonomic nervous system as opposed to the parasympathetic. So this hypoxia induces increased sympathetic outflow. This sympathetic outflow in turn increases cardiac output, attempts to bring about vasoconstriction, and increases the stimulation of the diaphragm and intercostal muscles to increase ventilatory effort. Now, the reason we call the chemoreceptors in the arch of the aorta and in the area of the carotid artery peripheral is as opposed to the central chemoreceptors. And the central chemoreceptors are central because they are located in the medulla oblongata of the brainstem itself. Now, the peripheral chemoreceptors respond to hypoxia and will respond to some degree to increased levels of carbon dioxide. But the central chemoreceptors only respond to increases in the level of carbon dioxide. Let's look now at what happens when the medulla oblongata does sense increased amounts of carbon dioxide in the blood. Now, what we've got here is these are partial pressures of carbon dioxide in the blood, and these figures are millimetres of mercury. The partial pressure of carbon dioxide, of course, is the proponent of the total pressure of gas in the blood, which is carbon dioxide. And these figures here, so 20, if you divide that by 7.5, you get 2.6, because that's the figure in kilopascals, because these are measured in two different ways. So 20 millimetres of mercury is 2.6 kilopascals, 40 millimetres of mercury is 5.3 kilopascals, 60 is 8 kilopascals, and 80 is 10.6 kilopascals. But the key thing I want you to notice here is that this figure here, this one here, this point here, this represents a normal respiratory rate. So that would be a normal respiratory rate. Increases in the amount of carbon dioxide, even in normal respiration, will increase ventilation, and this here is ventilation. And these figures here represent multiples of normal resting ventilation. So there's twice as much air going in and out the lungs as there is when the person is at rest. There's 3 times, there's 4 times. These are multiples of normal respiration. And what we notice is that as the level of carbon dioxide in the blood increases, this is detected by the central chemoreceptors in the medulla oblongata, and this massively stimulates ventilation. So increases in the amount of carbon dioxide in the blood will massively, physiologically, stimulate ventilatory effort. Now, this graph is looking at the effect of stimulation of the brainstem from the peripheral chemoreceptors in the aortic arch and carotid bodies and sinus. And as you remember, these are detecting oxygen lack. So these are figures of the amount of oxygen in the blood: 160 millimetres of mercury, which is 21.3 kilopascals, 120 millimetres of mercury, 80 millimetres of mercury, 10.6 kilopascals, 40 millimetres of mercury, 5.3 kilopascals. And again, what we've got here is one is a normal resting ventilatory rate, and 2 represents twice as much air going in and out the lungs as there would be at rest. 3 represents 3 times more air going in and out the lungs as there would be at rest. In other words, this is increased ventilation, increasing ventilatory effort. And what we see is that as the amount of oxygen in the blood drops, then ventilation increases. So the oxygen is dropping. This drop in oxygen is detected by the peripheral chemoreceptors. They send messages to the medulla oblongata of the brainstem. That stimulates the respiratory centre, which increases ventilation, and the ventilatory rate goes up and up and up and up as the oxygen levels go down. So decreased oxygen levels are going to stimulate ventilatory effort.